I was using drugs to the point where it consumed my life. I was arrested for possession and other things involved with that, and had burned every bridge. There was no one to call.
It was your oxycodone, oxycontin, mainly prescription drugs, 99%.
Whatever I had to do to get it in that period of time. Drugs on loan, stealing, finding ways to manipulate resources to make it work.
Anything good that was in my life, I put in danger. I can remember standing in my kitchen and saying out loud to myself that I can't do this anymore.
On a really long walk from the jail to Pleasant Garden in the rain, just finally decided that I had to do something different.
The next day is when I called and came to Triad and began the program.
We see it every day. Every time you open up the newspaper, on the news, you're seeing overdoses, you're seeing people dying.
The program we have created is not just opioid conclusive, it is all substance related. So when the opioid epidemic turns into another trending epidemic, our program will still sustain and will still be able to provide medical professionals with the information that they need to treat patients.
Creative Intelligence Services, PC, help clinics that do outpatient model treatment with 3 components: psychiatry or doctoring, counseling, and drug screening. We also provide consulting and help physicians and medicated-assisted treatment clinics work with sober living environments.
On an outpatient basis, people can come into a clinic like this. They can keep their job. They can work on their recovery, and they can get treatment medication. So that's why we call it a medication-assisted treatment program. Medication-assisted treatment is using medicines to help people with opiate addictions.
The medication is like almost a cast for the brain, to allow the brain time to heal and to allow the person to develop coping skills so they don't have to return to other drug use.
It's done on an outpatient basis, so you don't have to go into a hospital.
Specifically when using buprenorphine, Suboxone, Zubsolv are the trade names, it calms the brain down. It sits in their receptor sites the same way as the opiate. And so while their brains are stabilized, while their agitation is settled down, it allows them to put time and energy into developing emotional and life coping skills. We do that in group therapy and individual therapy. And once they've begun to stabilize and begun to build some self-confidence and the ability to cope with life without taking additional medication, we slowly begin to taper them down while we're continuing their supports. And we work with them about developing a nurturing support system in their family and their friends and also in their community.
One of the challenges of life is dealing with the stress that we have, and stress comes in all sorts of different forms, and addiction is something that sometimes happens because people have physical injuries for which they are prescribed narcotic drugs, which then become addictive.
We found that people involved in counseling have a much higher success rate. We know that if you participate in counseling and your doctor visit and you come to treatment, 52% of people succeed after 1 year.
You develop these relationships and these friendships, and drugs rarely get mentioned in the group anymore. It's a group about living sober. We kind of have to remind ourselves to bring it back to that sometimes.
One of the things that we do on an outpatient basis is we have meditation teachers that come and teach folks transcendental meditation.
It helps to reset the physiology by providing a deep rest and decreasing anxiety.
We found that's a very effective way for people to reduce their stress, which is a big trigger for addiction.
In conjunction with therapy and monitoring and with urine drug screens to make sure that they're only taking what's prescribed, it is a very controlled, safe way of preventing a return to use while rebuilding coping skills and improving their self-confidence.
As far as drug screenings go at Triad Behavioral Resources, we do utilize them as a tool in order to help clinical providers provide the best treatment.
The doctor gets that report, the counselor gets the report, and the patient is very involved in their own treatment plan.
They can ask and see those at any point. They can use those, their families can use those.
It's a point of honor for people that are coming in to stay clean, so they like to use that to show their family, their mother or father, if they're a young person, an employer, or the court.
All three, psychiatry, drug screening, counseling, are all very important together. Individually they can be helpful, but all together the result is phenomenal when it's done in that way.
Value of embedding a clinical program inside a sober living environment is that you really control a number of things that occur inside that environment.
Triad Behavioral works with the sober living environments by we actually go into the houses, we perform drug screens there, we bring group meetings to the houses, we do individual therapy, we do group counseling with them.
The same treatment providers are there each day, each week.
Residents stay a lot longer because they're getting everything they need and more, and we're bringing it to them.
The attrition goes down dramatically and the success rate goes up proportionally. So you have a lot more success. You have, you're keeping clients embedded into the program. You're developing a culture of recovery and treatment. And it just is a great synergistic experience for running an outpatient treatment inside one of these sober living environments. It creates a very, very powerful environment for recovery.
What kept me coming back is like I started to see positive things happen in my life, and I felt good about waking up every day. Like I started to feel happiness again, which I hadn't felt in quite a while, and that continued for as long as I've been here.
I'd already begun to see how my life was getting much better, not just for me, but my loved ones and those around me, like faster than I expected.
I have a relationship with my family, which for a long time I thought I burned that bridge to the point of not being able to rebuild it.
For people that are on the fence, I would say don't hesitate, especially now. It seems like with this epidemic, it's more dangerous and deadly than ever. The day or two you hesitate might be the day or two that, you know, you end up dying. So I would say not to hesitate and to come to a place like this. The transition is as smooth as I can literally think it possibly could be.
We've treated thousands of people through our clinics in Greensboro, in Danville, Virginia, in Roanoke, Virginia, and now in Winston-Salem, Asheboro, and Wilmington, North Carolina. So we've treated thousands, literally thousands of people on an outpatient basis successfully.